Senior Connections, a show about senior issues and events. A guide to active, independent living. Senior Connections, with your hosts, Margie Toms and Janet Halliday.
Good afternoon and welcome to Senior Connections. I'm Margie Wimberly Toms.
And I'm Janet Halliday. Today we are joined by Pam Lawrence. She is the founder of the Center for Health Integration, and it is an acronym called CHI. So I just want to make it clear to the audience that a lot of the modalities that she has available are available for all ages, but today we are going to focus primarily on the senior and adult modalities. And thank you for being with us, Pam.
Yes, Pam.
Thank you so much for inviting me.
I'm looking at your credentials here. Tell me what L, M as in mother, B as in boy, T stand for. That's part of your certification?
Yes, it is a licensed massage and bodywork therapist.
Okay.
But now you have a lot more than that. So
I do.
give us briefly your background.
I really
Yes.
began with a master's in social work and worked in Manhattan for X number of years. And then I had a career change and became a registered nurse through USC here in Columbia. And through that, worked in hospice and went back to get my massage and bodywork license.
Beautiful.
She's been almost around the block more than we have.
So we're not going to say how old we are.
Oh no, absolutely not.
So when did you open CHI? How long has it been open?
We started as a private practice. My partner, Arlene Fredericks, who's also a nurse, about 9.5 years ago.
Okay.
Ah, that's not too long, is it?
It's long enough for us, yeah.
All right. So the type of clients that you said you have,
Yeah.
or you've told us in your information that it's other folks as well as seniors. So we're
Yes.
denoting on seniors today, right?
Yes.
And tell me, in terms of your program, do you have that many seniors? You know, how do people become familiar with your program, your agency that you have, Pamela?
Well, primarily through word of mouth. Our advertising is limited to the website or the internet. But people get to know us and other people talk about us, and then we do have some physician referral as well.
Oh, that's good to know.
Right.
Yeah.
Now, I know that a lot of people want integrated health care, okay? Tell us the difference between what conventional medicine is versus alternative versus complementary.
Well, what we practice here is primarily conventional medicine. And that's where you have an illness or disorder and you go to see your physician or healthcare practitioner because you have a complaint and you're not feeling well. Complementary therapies, or in our case, integrative therapies, really focus on preventive health. So our job is to keep you healthy so that you will not suffer from the disorders and chronic illnesses that are common when we get older. But we also work together with conventional medicine. So the difference is, in an alternative practice, that's exclusive of conventional medicine. We like to work together.
Okay, so, go ahead.
I was just going to say now, in terms of your conventional medicine with the
Yes.
physicians, sometimes when they can't do anything more for a particular patient, do they oftentimes pass them on to you folks?
Yes, well, part of my
Yes.
history is also working as a hospice nurse.
Yes.
So I was able to integrate many of those practices at end-of-life care because they help people to be comfortable,
Absolutely.
to reduce pain, and just to ease life transitions.
Yes.
So, what is your primary specialty? I know you said you're a licensed licensed massage therapist,
Right.
but tell us about the other practitioners and some of their credentials.
Well, we have with us Cindy Schwab, who is a food energetics consultant, which is a new field, and it's really exciting. It's a little different than what you think of nutrition because she looks at the actual energetics of the food at the cellular level and how that affects the body. So it becomes very individual to the individual body. And in addition, we have a psychologist who works with us. And so she really focuses on what she calls inner dialoguing, but it's a way of listening to the inner wisdom of the person. Instead of us being the authority, you already have everything you need to know. We just help you to draw that out.
Now I want to ask you about the food, because this seems to be an area where a lot of people have allergies and they really don't know that they have allergies.
Yes.
It's true.
So does she work with a lot of folks that have food allergies?
Yes, and what's really interesting, she looks at all the parts of your body, what your blood type is, whatever kind of conditions that you have, your age, your weight, and really helps to focus on an independent nutritional outline that will serve you, not what the mass general public needs. It's what you individually need.
So she would work with getting a menu together then?
Yes, yes, she
Okay.
can help you to do that and also teach you about new foods that you might never have considered before.
Yes.
Okay,
Yeah.
and we're going to take our first break, and we have a wonderful new sponsor, Hall Tax and Planning Services, and he can take you from retirement planning to estate preservation, so give them a call. Wonderful group, and we'll be right back.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Comfort Keepers of Columbia, comforting solutions for in-home care, anesthesiology consultants, board-certified anesthesiologists with more than 400 years of combined anesthesia experience, serving these fine institutions throughout the Midlands for over 25 years. Ornegay and Mosley Funeral Home and Cremation Service, our family serving your family since 1884. Cindy Loma with ERA Wilder Realty, a certified senior real estate specialist. Central Midlands Aging and Disability Resource Center, serving Lexington, Richland, Newberry, and Fairfield counties.
Welcome back to Senior Connections. We are continuing with our guest, Pamela, and she's speaking on the Center for Health Integration. It's a very informative program. You're going to enjoy it. Now, Pamela, tell me, most of your chi or all of your chi modalities are non-invasive. Is that correct?
That is correct.
All right. Now, if you can just give our folks an idea of what non-invasive means, okay?
That means that there are no substances involved, we do not prescribe medications, and we
Yes.
certainly don't do any surgery.
Okay, good.
Well, that's good. Now, I want to. Your modalities have been broke out into mind, body, and spirit, correct? Okay, I want to talk about the mind modality, and the only one that we're going to talk about, and that's geriatric massage. Can you tell us a little bit about that?
Yes.
Absolutely. And first, I want to explain that mind, body, spirit is really an integrative process of the whole person. When we break it out, it's so that you can understand that there are specific therapies that really help to focus on one aspect. In the context of the mind, when we're talking about geriatric massage, it's really a form that helps to relax the body and so relax the mind. A gentle touch, an appropriate touch, really helps to stimulate the immune system. It helps to bring relaxation response to the body and really enables the person to begin to enjoy quality of life in a different way.
And so many of our seniors, especially those who live alone, don't ever have that ability or don't have the touch. And it is so important that we have touch. People just really, they don't understand that
Absolutely.
at all.
So it's basically a part of holistic medicine. Do you consider yourself in that category?
Absolutely.
Or is it separate?
Yes.
The same as holistic
Yes,
medicine.
when we're talking
right.
about integrative health, we are talking
Yes.
about holistic approach to full body healing.
Yes, and that touch is so very important in terms of a massage, just a little ache that they may have, and the simple a touch can remove that ache, you know, so I can really see you using it in the hospice industry, as you said.
Absolutely.
That you were familiar with.
When you think about it, when we get hurt, our first natural instinct is to touch where the
Yes.
hurt is.
Exactly.
And so that we're already built to respond to touch as a healing process.
Well, and then I wanted to talk about body. I know all these are integrated, but you've got them broke out. And the one is lymph drainage therapy.
Yes.
So tell us about that.
Yes.
Well, it's really specific to the body. The lymph system is a system that purifies the body's fluids. It's when we have a cold or a virus or an infection, all of those blood proteins and the toxins in the body filter through this fine network of lymph vessels. You know, when you have an infection, your lymph nodes get very swollen.
Yes.
That's because they're just little scavengers collecting up all the debris and purifying that so that the infection can be released. When we work with the lymph system, it's a very, very gentle manual touch on the body where the therapist can actually feel how the lymph is moving through the body, and we help to facilitate its clearing. It's wonderful for swollen joints, after surgeries, any place where there's inflammation and edema or swelling in the body.
Question.
Yeah.
In terms of application.
Yes.
Do you promote that also?
Absolutely. We do a lot of
teaching. If you have a headache or you have a pain in the neck, sometimes you just put your hand there and start rubbing. It feels better.
Yes.
So you teach them the application also,
Yes.
or encourage them?
Absolutely. We totally believe in self-care, and that's our primary focus. It's to empower you to learn how to take care of your own body.
I hope they can see it, but I wanted you to show a little bit about how that massage works.
Well, if I had a nickel, I could tell you that the pressure is no more than the weight of a nickel on the skin. But it's a very gentle, you can barely see the skin moving, if you can see that. And 90% of the lymph vessels are superficial to the skin. So all we have to do is this very, very gentle pumping or wave-like motion helps to bring that lymph, circulating it through the body so that you can have a better immune system.
Sure. So where there's pain, are you familiar with the magnet application to the skin?
I've heard of it, but we don't use it, so I don't have a lot of knowledge about it.
All right.
Now,
fine.
I want to focus a little bit on fibromyalgia. This type of drainage is really good for that disease or condition?
Or condition. I think it's essential for that condition. As massage therapists, we're very aware of what the tissue, the muscle, the fascia, that's the connective tissue, feels like in the individual body. And what we're finding is with fibromyalgia, that connective tissue, the deeper layer underneath the skin, becomes very rigid. And so with that rigidity, it prohibits the movement of the fluid in the body. We're 70% water. And if that's contained or restricted, that fluid compressed creates inflammation and pain and results sometimes in fibromyalgia.
Right.
So this
And
is
we're
a way
gonna
to clear that.
Yeah. And we're going to have to go, but sit tight. We'll be back with some more.
Hello, my name is Sean Owen. Today we're continuing our discussion on compression therapy. Traditionally, doctors write prescriptions for what they call TED hose. TED hose are traditionally a type of hose that are used for people who are non-ambulatory. They are a very light line of compression for people primarily, again, who are non-ambulatory in a hospital bed or a wheelchair. Standard Class 1 compression or Class 2 compressions are therapies that you can use and purchase over the counter, and they come in different types of grades. A TED hose is an 8 to 15 or 15 to 20 mmHg, and that's the amount of compression that's actually in the garment. A standard Class 1 compression is 20 to 30 mmHgs. A Class 2 compression would be 30 to 40, and then Class 3 would be 40 and above. You want to discuss your information with your doctor to make sure that you're getting the right indication when he does write a prescription for compression therapy. Make sure that you're also measured for compression therapy. It's very important that you be measured in the morning time when your swelling is less. For more information regarding compression therapy and other medical devices and aids, contact me, Sean Owen, at MedPoints Medical Specialties at 728-0122.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Chad Kurtz with New American Mortgage.
How have these homeowners achieved greater financial flexibility? With a reverse mortgage from a trusted source, MetLife Bank. If you're a homeowner age 62 or older, a reverse mortgage could make a difference in your life too.
It is the best thing we've ever done. I am so relieved.
It really lets me sleep at night.
Why not learn the facts today from a MetLife Bank reverse mortgage consultant? There's no obligation.
Welcome back to Senior Connections. Aren't we having a good time? We're continuing to talk with Pamela from the Center for Health Integration. And Pamela, what are we going to talk about next?
Well, I still had a couple of questions about the fibromyalgia. If somebody's taking pain medication for the treatment, because usually the doctors are treating the symptoms of pain, and they start going through some of these therapies, how many have you had that maybe got off of the pain medications?
Oh, that's a good question. I would say most.
Oh, that's
I can say.
That,
but primarily because when you're working with touch therapies, that in itself can reduce the experience of pain because we're reducing inflammation. Fibromyalgia is a very complex symptoms of very mixed symptoms, including pain, depression, restriction of movement in the body. And so the treatment that we offer specific to that, which is called inflammation reduction therapy, is a multi-pronged approach. We're looking at how to replace things within the body through using essential oils, through using massage, through specific exercises, and most important, through nutrition. Because if you don't have adequate nutrition, that causes inflammation in the body, causes pain. So it becomes a cycle or a syndrome that is very difficult to treat or cure because it's not one thing.
and that's right. It is a cycle or a syndrome. There you hit it.
Pamela, I'm so glad you explained that to our seniors so they will know exactly. Sometimes they may be experiencing a set of symptoms and may not exactly know what it is, and sometimes they can be ahead of their doctors, and since they know about fibromyalgia now, they can kind of mention that when they go for a visit, right?
Good deal. Okay.
Absolutely.
Well, the next one we want to move to is the craniosacral therapy.
Yes.
So tell us about that, and who would be a good candidate?
Anyone from birth through seniors really could benefit from craniosacral therapy. And I'll start by explaining that it was developed by an osteopath, Dr. John Upliger. He's since become world renowned for his work in helping with people from everything from autism to severe chronic neck and back dysfunction. The craniosacral therapy really talks about sacral, from your tailbone to your cranium, to your head. It's the spine and the central nervous system in between, all of that. And so the therapist is trained to listen to this very subtle rhythm within the body and feel for places where there are restrictions in the tissue, and help to facilitate that cerebral spinal fluid, the fluid that nourishes our brain, so that we can have reduced inflammation and really ease of living in the body.
Now, the first thing that came to my mind when I read that is, do you do x-rays?
Absolutely not.
Okay, no x-ray. And how are you different than from maybe a chiropractor?
Oh, we do not do anything with the bones of the spine. Massage therapists work with soft tissue only.
Well, I wanted to just get that clarification because I know somebody out there is thinking, well, now wait a minute, what's the difference here?
I'm looking over your list of conditions that this craniosacral therapy addresses.
Yes.
Would you include carpal tunnel syndrome in that too?
Yes, we could.
And what has been your prognosis in terms of that?
It really varies on the individual. Unfortunately, most of the time when we see people, it's at the most chronic stage. If they would come to us earlier, we can have a little bit more effective results. But it can be helpful. And again, we're looking at that whole central nervous system within the body and how that affects pain and inflammation.
And so it lists the post-traumatic stress disorder. Now, tell us how that all works together.
Well, first I'd like to lop off the disorder part, because post-traumatic stress is really a natural way for the body to deal with stress. And we go through this process of healing that's natural and normal. But within that framework, craniosacral therapy at its advanced practices enables a client to facilitate those emotions and trauma and stress that have literally been stuck in the body. So our body tissue holds memory, and we know this as a matter of research at this point. It holds the memory, and sometimes people who have experienced trauma have not been able to find a way of releasing that so that they can go on and experience their life wholly. So in this work, we help people to dialogue with that body, release the place that has held the trauma, which we call an energy cyst, because it's contained within the body, and that allows them freedom, not just of movement and from pain and inflammation, but freedom on a very spiritual level so that they can reconnect the way they need to in their social group and community.
Now, I know we had met originally at a VA conference.
Yes.
Are you working with veterans now?
We have been working with them. I was very much privileged to be part of a clinical team that worked in New Mexico with Vietnam veterans. And so we spent 7 days working. There were 3 of us working with veterans. Sometimes we would see them 2 or 3 times a day. And these were particularly men who have been diagnosed with post-traumatic stress for over 20 years.
Okay, and we're going to take another break, but don't go anywhere. We'll be right back.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Senior Living Guide, serving the Midlands for more than a decade. Life Care Center of Columbia, doing whatever it takes and then some. Harry Crosby, educating people on solutions available for long-term care for almost 20 years. Brookdale Senior Living, providing exceptional senior living for over 30 years. Aging Gracefully, a senior living consulting service.
Welcome back to Senior Connections. We are again talking to Pamela from the Center for Health Integration. And Pamela, going back to the Chi craniosacral therapy, is there a lot of verbiage going on between the therapist and the client, or is it just all hands-on? Do you talk with them also?
We do what's called dialoguing with the inner physician. And so with that, we may simply ask a client, what are you experiencing now? And allow them to respond and allow them to bring up if they're having any memories or emotions. But really it's generated through the client with the therapist facilitation.
Okay.
And the last category, although you integrate all these things together, they're all interwoven, is the spirit. And I want you to tell us briefly about some of those, because you brought a bowl today and you also do aromatherapy.
And we also do aromatherapy.
And believe it or not, that bottle says clarity, and I'm not sure that we have any today. But tell them about the bowls and the raindrop therapies.
Okay, well, the bowls are a tradition of the Tibetan culture. So we all know that when we hear sound, it draws us together as a community and it draws us into stillness. And if I could just chime the bowl one little bit, you can understand why. So as soon as you hear that resonance, the harmonic tones, all of a sudden your attention is to the bowl. And when we use them in a therapeutic setting, it helps people whose minds just cannot be still. They're just full of chatter. And to tell to someone to relax, you can't relax their mind. And you don't have that kind of power. But when you chime a sound, the body immediately responds to that and settles down and becomes quiet. So the question about
the raindrops.
The raindrop is we use therapeutic essential oils along the spine and then massage them into the body, so that the oils are very specific according to nature, grown from natural plants and herbs from the earth, so that they can interact with the human body's cellular intelligence. And those oils then help to formulate the natural healing within the body without chemical intervention.
Now,
one question. The raindrop, I think, threw me off. Because not being from the South, being from the North, I used to hear my husband talk about the raindrops coming on the tin roofs in the South. And you hear so many people and how soothing it was and how they went to sleep, and it was, so that's what made me think of the raindrops coming down on the tin roof, and I understand they're making tin roofs again now.
Because we
in the
love the
market.
sound. I love the
So that
sound of
sound
that.
had something to do with it, didn't it?
So that's sound, what we would think of as sound
Yes,
therapy.
back to the sound
Yes.
therapy again.
Right.
When we
And-
use the essential oils, they're applied like raindrops
Right,
along the
raindrops.
spine. So you just feel these tiny little
Oh,
drops along the
interesting.
spine. Yeah.
Well, and you also use what, tuning forks and that
Yes.
sort of thing on the spine. But I want to get to, does insurance pay for this?
No.
Okay, what is the average or typical cost for a session?
But if you come in for a single session, that's an hour and a half, it would be $100. A 1 hour session is $70. But people who are going to be committed to doing the therapies, we
Yes.
offer a discount to them to make it much more affordable.
Okay, and then should they prepare some way before they come in? I mean, how do they usually dress? That's kind of
If you're going to have a massage, you want to be in clothes that are comfortable to come on and off so that you can dress comfortably when you're off the table. But for the body work therapies, you stay dressed, and we just ask you to be comfortable. Wear sweat clothes, elastic waist, something that you can get on and off
And most
easily.
importantly, you can try these therapies the second Monday of every month from 6 o'clock to 8 o'clock at St. Timothy's Episcopal Church.
Yes.
Correct. So for those of you who are thinking this might be voodoo, it is not. And you will have a free opportunity to go and try this and see if you like it and it's going to work.
One more thing, do you have a pamphlet that you put out that you give away to your clients when they come in?
We do. When they come to St.
All right.
Timothy's, that information is available.
Are some of your testimonies in that pamphlet?
Some are, but we'll do more.
How
That's
about
right.
that?
And be sure and pick up your copy of Senior Living Guide that's on statewide. And we want to give a thanks to all of our sponsors that support Senior Connections. Please, if you have need for their services, give them a call because they're supporting you. Thank you for being with us today.
Yes, and we'll see you next week, and be blessed.
For more information on the topics discussed on today's show, to learn about upcoming senior events and support groups in the Midlands, or to submit a question, go to seniorconnectionssc.com. You can also call us at 803-739-4205.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Comfort Keepers of Columbia, comforting solutions for in-home care, anesthesiology consultants, board-certified anesthesiologists with more than 400 years of combined anesthesia experience, serving these fine institutions throughout the Midlands for over 25 years. Born Again Mosley Funeral Home and Cremation Service, our family serving your family since 1884. Cindy Loma with ERA Wilder Realty, a certified senior real estate specialist. Central Midlands Aging and Disability Resource Center, serving Lexington, Richland, Newberry, and Fairfield counties.